In a world still grappling with the aftermath of the COVID-19 pandemic, the emergence of another infectious disease, monkeypox, has raised global concerns. While it's not a new virus, its recent spread has led to questions and fears. Could monkeypox be the next global health threat? Or are we simply more alert after the scars left by the pandemic? In this video, we'll dive deep into the origins of monkeypox, explore its transmission patterns, understand the potential risks, and evaluate whether it could truly become a global health crisis. Monkeypox is a viral zoonotic disease, meaning it can be transmitted from animals to humans. First identified in 1958 among research monkeys in Denmark, monkeypox has since been observed primarily in remote parts of Central and West Africa. Despite its name, monkeys are not the primary carriers. The virus is more commonly found in rodents, like squirrels and Gambian pouched rats. The virus belongs to the orthopox virus genus, the same family as the variola virus, which causes smallpox. However, monkeypox is less deadly. While smallpox had a mortality rate of around 30%, monkeypox has a much lower rate, ranging from 1% to 10% depending on the strain and healthcare availability. Monkeypox can spread through close contact with infected animals, such as bites, scratches, or consumption of undercooked meat. Human-to-human transmission, although less common, occurs through respiratory droplets, bodily fluids, and contaminated objects like bedding. Once infected, the incubation period is typically 7-14 days but can range from 5-21 days. The disease begins with flu-like symptoms, fever, headache, muscle aches, and fatigue. These symptoms are followed by a rash, often starting on the face and spreading to other parts of the body, including palms and soles. The rash progresses through stages, from macules to papules, vesicles, and pustules, before crusting over and eventually falling off. The entire illness typically lasts 2-4 weeks. In terms of contagiousness, the basic reproduction number, R0, of monkeypox is estimated to be between 0.6 and 1. This is relatively low compared to other infectious diseases, like measles, R0 of 12-18, or COVID-19, R0 of 2-3. However, the fear lies in the fact that even a low R0 virus can spread significantly if introduced into a population with no immunity, especially in densely populated areas. While monkeypox has been known for decades, the recent outbreaks in 2022 and 2023 caught the world's attention because they occurred outside of Africa, in countries like the United States, the United Kingdom, and several European nations. As of August 2023, over 30,000 confirmed cases have been reported across 40 countries, with the majority in non-endemic regions. What's particularly concerning is the changing pattern of transmission. Unlike previous outbreaks, which were largely confined to rural African regions and associated with contact with wild animals, recent cases have shown more evidence of human-to-human transmission, particularly in urban settings. The World Health Organization, WHO, has been monitoring these developments closely. Dr. Rosamund Lewis, who's technical lead for monkeypox, highlighted in a press briefing that the virus's behavior is showing new characteristics in its spread patterns. This includes the appearance of cases with no clear link to known endemic regions or infected animals. Data from the UK Health Security Agency, UKHSA, also revealed that many recent cases were detected among men who have sex with men, MSM, suggesting potential sexual transmission. However, it's important to note that monkeypox is not considered a sexually transmitted infection in the traditional sense. Rather, close contact during sexual activities could facilitate its spread. To assess whether monkeypox could become a global health threat, it's helpful to compare it to other infectious diseases. 1. Smallpox versus monkeypox. Smallpox, eradicated in 1980 through a global vaccination campaign, was one of the deadliest diseases in human history. Monkeypox, while related, is much less severe. The mortality rate for monkeypox is about 10 times lower than that of smallpox. Moreover, existing smallpox vaccines provide about 85% protection against monkeypox, which is a significant buffer against potential outbreaks. 2. COVID-19 versus monkeypox. COVID-19 took the world by surprise due to its high transmissibility and the fact that it was a novel virus, meaning no one had prior immunity. In contrast, monkeypox is less transmissible, and some level of immunity exists in the population, particularly among those who received the smallpox vaccine. Additionally, monkeypox does not spread asymptomatically, making it easier to identify and isolate cases. 3. Ebola versus monkeypox. Ebola has a higher mortality rate, up to 90% in some outbreaks, and spreads rapidly in regions with poor healthcare infrastructure. Monkeypox, while serious, is not as deadly and spreads more slowly. However, the challenge with monkeypox lies in its potential to spread silently in urban areas before being detected. But, is there a vaccine available for monkeypox, and what is the global response? One of the reasons smallpox was eradicated was the effectiveness of the vaccine. Fortunately, the smallpox vaccine also provides cross-protection against monkeypox. The WHO has stockpiled smallpox vaccines, and several countries have initiated vaccination campaigns targeting high-risk groups, particularly healthcare workers and close contacts of confirmed cases. The United States, for example, has begun distributing the Jynneos vaccine, also known as Imvamune or Imvanex in Europe, which is specifically approved for monkeypox. According to the Centers for Disease Control and Prevention, CDC, the vaccine has an efficacy rate of around 85% in preventing monkeypox. As of August 2023, over 1 million doses have been administered globally. However, the challenge lies in vaccine accessibility, particularly in low-income countries. While wealthier nations have secured vaccine doses, there are concerns about equity and the potential for outbreaks in regions where vaccines are not readily available. The WHO has emphasized the need for a coordinated global response to ensure that all countries have access to vaccines and antiviral treatments. Given the data, is monkeypox the next global health threat? The answer is complex. On one hand, the virus has characteristics that make it less likely to cause a pandemic on the scale of COVID-19. Its lower transmissibility, existing immunity from smallpox vaccination, and the availability of effective vaccines all work in our favor. On the other hand, the recent changes in transmission patterns and the spread to non-endemic regions indicate that monkeypox could pose a significant public health challenge. The virus could establish itself in new regions, particularly in urban areas, leading to periodic outbreaks. The possibility of the virus evolving and adapting to human hosts is another factor that cannot be ignored. Furthermore, the psychological impact of another infectious disease spreading globally, especially so soon after COVID-19, cannot be underestimated. Public fear and misinformation can exacerbate the situation, leading to stigmatization of affected groups and reluctance to seek medical care. To prevent monkeypox from becoming a global health threat, a multifaceted approach is needed. 1. Surveillance. Enhanced surveillance in both endemic and non-endemic regions is crucial. Rapid identification and isolation of cases can prevent further spread. The WHO has called for countries to strengthen their surveillance systems and report any suspected cases immediately. 2. Vaccination. Expanding vaccination efforts, particularly in high-risk areas, is key. Countries should work with international organizations to ensure equitable access to vaccines and antiviral treatments. 3. Public awareness. Educating the public about monkeypox, its symptoms, and how it spreads can reduce fear and encourage people to seek medical care early. Public health campaigns should also focus on reducing stigma and ensuring that affected individuals receive the support they need. 4. Research. Continued research into the virus's behavior, potential treatments, and vaccine efficacy is essential. Scientists are also exploring the possibility of developing new vaccines that are more specifically targeted at monkeypox. So, is monkeypox the next global health threat? While it has the potential to cause significant public health challenges, it is unlikely to reach the scale of pandemics like COVID-19. However, the situation demands vigilance, global cooperation, and proactive measures to prevent the virus from spreading further. As we've learned from past pandemics, early action is crucial. By staying informed, supporting vaccination efforts, and following public health guidelines, we can prevent monkeypox from becoming a major global health crisis. Let's work together to stay safe and protect our communities. Thank you for watching. If you found this video informative, please like, share, and subscribe for more in-depth analyses on global health issues and other trending topics. Stay safe, and see you in the next video.